Good afternoon, everyone. Today we are going to be talking about farm subsidies and the economic impact and health policy. On today's agenda, we are going to be going over what is a farm subsidy, what is the cost and cost benefit of these farm subsidies, how effective are farm subsidies for our communities and our population, what is the nurse's role related to farm subsidies, what types of nursing organizational involvement do we have with these? And then lastly, the impact of our workforce and healthcare organizations. So first off, wanted to define what is a farm subsidy. So is it a financial aid that is provided by the federal government to farmers and agricultural businesses? There is a farm bill, which is a legislative bill that shapes our agricultural environment, helps with food production, rural development, conservation, and nutrition assistance. It's actually this farm bill that was enacted in 1933 is actually going through a revision in 2025-2026. It is expected to actually help enhance our financial security and increase market opportunities for our farmers. The cost of a farm subsidy. Farm subsidies in farm production is to increase food security and promote agricultural development. In 2024, the government provided $9.3 billion in payments to farmers for commodity crops. Subsidies account for 5.9% of total farm earnings, which most of the funding goes towards corn, soybean, and cotton. Market distortion can incentivize overproduction, surplus global prices, and disadvantage small or diversified farms. So as you can see from the graph to your right, government payments contribute to on average 13.5% of the net income, farmer income. As you can see, once we go through any types of hardships or depression, we put a lot more funding into our farm subsidies to continue to help farmers produce crops and for that food, increasing that food security. Overall, what is the benefit for farm subsidies? Farm subsidies help with food price stability, so it helps maintain stable and affordable food supplies. Income protection for our farmers, so crop insurance to reduce financial risk due to weather, pests, and market instability. And then also supports our rural economic stability. So supports employment and economic activity in our rural communities. So what are the effectiveness of our farm subsidies and the Farm Bill? So first enacted in 1933, the program was originally designed to stabilize agricultural markets through price support, supply regulations, import barriers, and crop insurance. The subsidy structure continues to disproportionately benefit commodity crops, as I talked about before, such as the corn, wheat, soybean, and cotton, which then underinvest in our fruits and vegetables. Farm subsidies are effective in stabilizing food systems and farm incomes, but however, they are less effective in promoting population health and equitable economic outcomes. So what is the economic impact to food insecurity? So farm subsidies have been a focus to address these food insecurities within our United States. The focus has been historically on the commodity crops such as corn, soybean, wheat, and cotton. These crops are commonly used in ultra-processed foods, which can be linked to poor diet quality and higher risk of cardiovascular disease, obesity, and mental health conditions. So as we look at our population health, investing in our fruits and vegetables is going to be critical, as right now it remains limited continuing that cost gap of discouraging healthy eating. So we do have some types of nutrition assistance programs, such as our Supplemental Nutrition Assistance Program, which is commonly known as SNAP, and the Special Supplement Nutrition Program for Women, Infants, and Children, which is commonly known as WIC, which play a vital role in easing food hardship for individuals going through any type of hardship. However, these programs are facing limitations that hinder their ability to address upstream drivers for poor dietary intake. So when you are investing in ultra-processed types of foods, it really does have a downstream effect to the end user, which is our population, on how we are eating, what we are consuming, and our nutritional value of what we are getting from these crops. What is the overall impact of farm subsidies? So farm subsidies are effective in stabilizing our food supply and supporting our local farmers or farmers' incomes. However, they continue to present challenges in improving population health and promoting nutrient-dense foods to the consumers. This is where nursing is going to play a vital role for advocating and promoting high nutrient-dense foods within agriculture, and then ensuring that we are including those in our agricultural and food policies. At this time, I wanted to leave an opportunity for any questions related to farm subsidies and their impact, cost, the benefit, the effectiveness, and then how are they affecting our population as a whole. Alrighty, I'm not hearing any questions, so we'll go on to our next topic of how nursing plays a vital role within our population health and farm subsidy setting. So what is the nurse's role as it relates to farm subsidy? So currently the role of nursing, the primary focus has been included in the health and safety of our farmers, pesticide control and exposure, food insecurities within our communities, and environmental impacts related to water contamination, air pollution, and climate change. Nurses promote and protect population health by applying knowledge from nursing, social, and public health sciences. Screening for food insecurities in clinical and community settings is a very crucial step in understanding what is our population health of that community, and then providing education on nutrition and healthy food choices to our end users, our communities, having initiatives within our communities to really provide that education and a good start for our communities. Like I said, for those local types of incentives and support buying local foods. So how can we leverage nursing and farm subsidies together? So how can we bring these two approaches together? Nurses need to promote nutrient-dense foods and become involved in agricultural policy. This is a crucial step in order to us having a downstream effect on what we are putting on our tables and what we are promoting to our children, our infants, and our population as a whole. Farm bill provisions, like I said, should emphasize fruits, veggies, and sustainable agriculture so we can balance our population health, our farmers, and ensuring that we are supporting a healthy community, which then goes into promoting health equity by integrating nutrition metrics into agricultural policies. So how can we blend these together in order to have a really good end result for our communities? And then ensuring we're engaging in our federal and policy levels on issues related to farm subsidies. So, as chief nursing officers and nurse leaders, how can we get involved? How can we leverage our skills and expertise in nursing and relate those to what we currently have with farm subsidies? Really set big advocacy and promoting policies that address food systems and chronic disease prevention. We also need to advocate for local incentives to improve food access and nutrition. And then how do we connect our farmer subsidies to our measurable health outcomes. So what types of nursing organizations are involved with farm subsidies? So our American Public Health Association, this is the public health sector that advocates for health equity, food access, and environmental health policies. And then also our American Nurse Association helps to develop useful policies that influence external policies at our local, state, and federal levels. I just wanted to pause to make sure that we have any questions as we are connecting the nursing profession to our current farm subsidies that we have within our communities and our United States. All right, I'm not hearing any questions, so we will go on to our last and final section. So how overall is there implications on our workforce, both short-term and long-term for nursing? So the nursing demand will continue to increase for education, promotion of nutrition programs, and chronic disease management. There will also be, if we continue with our current farm subsidy model, we will sustain investment in those less nutrient-dense foods and maintain a primary focus on those commodity crops, like I said before, the corn, the soybean, and the cotton, where they aren't nutrient-dense foods, where we need to be then focusing in on our fruits and vegetables that are nutrient-dense and would help with our population and our overall wellness of our communities. There will also be put a strain on our healthcare systems. So as we continue to see ongoing health-related issues to modifiable types of risk factors, we will continue to see an increase in the need for acute services and more services needed. So we talked about the short-term workforce implications. So what are the long-term workforce implications? So nursing burnout in population health settings may be driven by persistent upstream policy gaps related to health promotion. So really promoting those nutrient-dense types of foods and any types of activities that go with it to help decrease the modifiable types of risk factors and the overall health promotion of our communities. Also, preventative illnesses will continue to be on the rise, so placing increased strain on our healthcare systems and resulting in a growing number of complex patients requiring acute care services, which then will in turn increase the cost of care for our patients and our communities. So as we talk about the workforce, we have to then in turn talk about the organizational impact, both short-term and long-term. So short-term, healthcare costs, like I said before, will continue to rise due to the treatments of individuals with preventable comorbidities, multiple comorbidities. We're seeing that today with patients who come in not just for one thing, but multiple things, which would then in turn increase their length of stay. And then higher staff turnover may increase due to the rising acuity of our patient population. You know, in a healthcare setting, we try to keep those ratios low, 1 to 4, 1 to 5 types of ratios, but when you are constantly adding additional comorbidities on, it can be very taxing for our workforce, our nurses, our providers, and anyone that are frontline teams at the bedside. So what are our long-term organizational implications? So limited emphasis on prevention will drive greater resources needed for chronic disease management. This will increase the need for acute interventions and lead to higher number of emergency room visits. Resource constraints can lead to very unsafe conditions or low quality of care that we provide to the patients. And then higher turnover rates can lead to workforce shortages within the organization, and then healthcare workers actually leaving the profession altogether. Adding additional resources to the organization can also be costly, as right now reimbursement is not sustainable for an organization, so we really have to have a primary focus on preventing patients or preventing our communities from utilizing those really expensive acute resources. conclusion, how do we tie this all together? How do we connect those dots? So farm subsidies are a highly important topic that requires attention as they have many downstream implications that extend beyond agricultural and influence our population health, healthcare costs, and workforce resources. Current farm subsidies continue to provide poor nutrition, which can be linked to chronic diseases. So we need to make sure that we're advocating for changes in our policy when it comes to farm subsidies. And as nurses, we have a responsibility to engage in policy related to farm subsidies so we can then enhance the overall population health of our communities. And then the goal is to improve our current policies to align with population health priorities to enhance overall community health. So this will in turn will then have a reduction in healthcare costs, lessening strain on limited RN resources, and promoting a healthier future for our coming generations to come. So this concludes our presentation for today. Are there any additional questions that I can answer at this time? If not, there is a QR code that you can scan. It will email me any of your questions and I'd be happy to answer those or get the resource to answer those questions. So appreciate everybody's attendance today and hopefully you all have a fantastic day. Thank you.